Okay, we're at about 70 plus participants, so I'll just get us started with a couple notes on housekeeping. Welcome everyone, and thank you for joining us today during the applicant webinar for the Find Unitate Advocacy RFP. My name is Nasheen Hawk, and I'm on the Act A Diagnostics Coordination Team at Find. Before we get started, I just wanted to note that we are kicking off with an overview of the RFP, including the scope, deliverables, processes, and timeline, and then we'll move on to the second portion of the webinar, which will be the bulk of the time here for Q&A. So please feel free as we talk through the RFP overview to utilize the Q&A box. We are providing support in interpretation in French to English and English to French today. But if you do have a question you'd prefer to ask in a language other than English or French, in Spanish or Portuguese, please feel free to jot that down in the Q&A box. And of course, as you go through the RFP overview, feel free to note any questions in the Q&A box and we'll address them before we kick off the live Q&A portion. If you'd rather ask your question live, feel free to hit the raise hand button and we will unmute you during the Q&A portion so you can ask your question directly. As noted, we are having two-way interpretation in French to English as well as English to French. So please feel free to hit the interpretation button in the lower right-hand corner to access the French interpretation channel. And I believe that's it. So without any further ado, I will introduce my colleague Willow Brock to talk us through the introduction to the context for the RFP development. So Willow, over to you.
Thank you very much, Nasheen, and welcome everyone to this first presentation. For those of you who prefer communicating in Spanish or Portuguese, as Nasheen was indicating, tomorrow is a exactly identical session, but then with co-interpretation in Spanish and Portuguese. As I said, welcome. This is a presentation organized by the ACT Accelerator, with Find as the co-lead of the diagnostic pillar, as well as Unitate as the co-lead of the therapeutic pillar, coming together with our colleagues from CHAI and UNICEF, who co-lead the diagnostic pillars country support working group. The work is obviously under the advocacy, communication, and community engagement work that we are trying to promote. With this RFP that we're discussing today, we're aiming to create an enabling environment for increased access to and scale up of COVID-19 testing and linkages to treatment in target regions, basically LMIC countries as defined in the OECD and World Bank list of countries. We all appreciate the attention for vaccination and equity in vaccination, and vaccination remains a cornerstone of the response, but we do know that additional public health interventions around testing and treatments are critical to prevent transmission and save lives and end this pandemic for everyone equally around the world. Omicron has once again proven that this is an essential truth. At the same time, we see that the advent of low-cost rapid antigen tests that we have been working on with many partners around the world is facilitating a more decentralized and community-based testing approach. And this is where many of you come in. Greater provision of tests alone will, however, not increase the uptake. Drawing upon the experience of communities and civil society is critical for the rollout of testing. So to bolster test and treat approaches and the avoidance of a further emergence of a two-track pandemic born out of inequity, we need context-sensitive advocacy strategies in countries. So this RFP today is focused on getting in-country advocates, civil society, media providers, technical agencies to support in creating advocacy and communication materials and creating awareness in the end of prioritization of testing as a key element of national pandemic response. Again, last year, we've seen leaders around the world come together, like at the UN General Assembly and the US hosted COVID-19 Global Summit, to basically set a testing rate of 1 per 1,000 people per day in all countries as a target. This is far beyond what we're currently reaching. And although still not completely in line with high-income country testing, it's of a point on the horizon we want support for. This is where some of you on the line hopefully will come in with proposals. So to learn more about these objectives of the RFP and the application progress, I'm going to now turn it over to my colleagues Nosheen and Karishma, who have been working on this RFP and will present the basic tenets of work. Over to you, Nosheen and Karishma.
Great, thank you so much for that overview, Willow. And diving right into the RFP details. So the overarching goal of this RFP is to create an enabling environment for increased access to and scale up use of COVID-19 testing and linkage to treatments. And then to that end, it's jointly issued by FIND and Unitaid in their respective capacities as co-conveners of the diagnostics and therapeutics pillar. The total envelope for this call for proposals is approximately $2 million with an average anticipated award of $50,000 to $100,000. And as noted in the RFP, we are issuing the call for proposals and accepting applications and supplemental documents in English, French, Spanish, and Portuguese, and the closing date is February 2nd. So this is a brief overview of the scope and deliverables expected as an outcome from this call. So the scope is that it's restricted to national or regional health awareness raising and advocacy. And we want to clarify that the use of regional here represents a region within a country, not a collection of countries. So it would be, for example, South India, as opposed to like all of South Asia. We expect that applicants will consider advocacy approaches that will increase testing rates in line with the UNGA testing targets that Willow just mentioned of 1 test per 1,000 per day and adequate linkage to treatment. Activities should be centered on advocacy strategies, literacy, messaging, and media that's pertinent to the local context, as well as consider wider dissemination and amplification. And the expected deliverables include a multi-pronged advocacy strategy to increase testing and demonstrate adequate linkage to treatment based on the local context, including challenges, opportunities, and target audiences. We expect tailored messaging on testing and diagnostics for the local context and proposed target audience. And we expect that these are also pressure tested through focus groups, social media, et cetera, to ensure that these are, in the opinions of the selected partners, the most relevant messages for that selected audience. We expect advocacy and educational materials to be translated into local language and also tailored to the local context for both high-level advocacy and community-level outreach. To this end, we are, as outlined in the RFP, preparing a short toolkit with like the latest facts, data, visuals, and other supporting information to ensure that our partners are approaching their advocacy strategy development and materials development with a unified understanding of the latest information from the diagnostics and therapeutics pillar. And I'll go into a little bit more detail on that in the next slide. And lastly, we expect dissemination and amplification of these advocacy strategies and educational materials via multiple channels as appropriate for the local setting and proposed target audience. So in terms of the applicant profile we're looking for and exclusion criteria, this is covered in depth within the RFP text, but we do want to stress here that we're looking to have quite an inclusive approach. So proposals are welcome from a wide range of organizations in LMICs, provided that they are implementing at the country level. So this is including but not limited to health sector implementers, marketing agencies, advocacy organizations, nonprofits, community-led and CSO organizations, as well as faith-based organizations. But we'll certainly happy to consider applications from organizations that don't fall under the categories named here. So while we are trying to cast as wide a net as possible for applicants, we do have certain basic requirements for consideration, the exclusion criteria as outlined within Section 8 of the RFP. So to aid applicants in assessing their suitability to apply, we have prepared a self-check form, which is required as part of the proposal submission in Appendix B. But I do want to note that this self-check form doesn't cover all of the exclusion criteria. So we encourage you to both fill out this form as part of your submission and also ensure separately that you adhere to all of the exclusion criteria requirements. And for this portion, I think I'm handing over to Karishma.
Thanks, Nosheen. And yes, very quickly to just go over the timelines. We expect the proposals to be submitted by the 2nd of February. And as of now, we're not expecting any changes to the timelines, although if there are any changes, they will be communicated via our calls for partners page, the link to which I have already dropped in the chat box. As Nosheen already mentioned, the applications and supporting materials can be submitted in English, French, Spanish, and Portuguese. And we have reviewers who will be forming the selection committee who will be able to review in all of these languages. So the RFP was published on the 12th of Jan. Today is our first applicant webinar, and tomorrow will be the second one with interpretation available in Spanish and Portuguese, and it will be the exactly same presentation and the same webinar. The recordings to both sessions will also be made available on our Calls for Partners page. The deadline for the written queries is the 26th of Jan. We've already received quite a few written queries, and we've also tried to respond to them in real time. And if we haven't, apologies, we are really working to answer them as quickly as possible. Don't hesitate to remind us in case we haven't responded to you. The RFP will close on the 2nd of Feb, and the selection committee will convene shortly after, and we hope to announce the awards of the contracts on the 23rd of Feb. After which, if there is any financial due diligence requested by our contracts team, that will take place in the week of 9th March, following which by the 18th of March, we're hoping to sign the agreements. The terms and conditions of the agreement is already mentioned at the bottom of the RFP, so I hope you've had a chance to go through that. We will announce the awards by the 21st of March. And as Nosheen already mentioned, there will also be a review of the advocacy strategies and materials that the organizations are planning to develop. And these materials that will be disseminated for awareness raising can be in any of the 4 languages mentioned here on this page, but they can also be in local languages. The midterm project reviews will be completed based on the start date suggested by the project team. And there will also be final reporting and performance data evaluation by our team. We expect that, again, it depends on the timelines selected by the agency in question. But the projects should range between 6 to 18 months typically. Next slide, please. And just before we go into the panel Q&A, we wanted to share a few of the questions that we have already received. So one of the most popular ones was, is there more than one proposal allowed per country? Yes, at this stage, there's no restriction on number of applications per country, although an organization can put in only one application. And at the moment, we are accepting all applications, but of course, we will be selecting them based on the evaluation criteria. And we also want to ensure that there is a fair geographical representation across the target regions in question. Will the award or the contract be issued in French, Spanish, or Portuguese? No, the award, which is the actual contractual agreement, will be in English, although the proposals, as I mentioned on the previous slide as well, can be submitted in English, French, Spanish, or Portuguese. Do the advocacy strategies and dissemination materials need to be in English? Again, as I mentioned previously, the materials can be in any of the 4 languages, and they can also be in the local languages. but for the purposes of review of the strategies that the plans that the organization intends to roll out, we would prefer for that to be in one of these 4 languages. And regarding the definition of LMIC, which is a low and middle income country, that has also been shared. A link to the OECD definition that we are using has also been shared in the chat box. So please refer to that to make sure that your country falls under the LMIC definition. And with that, I think the slides are over and we can move on to the Q&A.
Thanks, Karishma. Shall I take a few ones that have come by in the chat that I think would be good to clarify before we look for others?
Yes, please.
So there's a number of questions that were asked about the eligibility of the individual organizations and the ability to create consortia. So the issue is we want individual organizations to submit the proposal to take full responsibility. It's up to the organization to decide to create a consortium and to split the work. So if an NGO in a certain country wants to partner with the Ministry of Health and with another NGO, that is certainly allowed, but we will just want to receive the application from the lead agency who will take responsibility for the full implementation. So it's up to you to decide in how to organize it behind the scenes. We will just have one contract with an organization. There was also a question on whether in the difference between individual advocates and organizations. The exclusion criteria very clearly, we cannot contract any individuals in any form or shape. We would have to work with a registered organization in the country. So if obviously we would want very experienced people to participate in this, but through an organization. So it's up to you again to work with individual advocates and employing them, but the organization has to be an NGO. The status, whether an international NGO, for-profit, non-for-profit, is quite widely, as was indicated by Naushin. The only thing that some INGOs have is that they don't have a formal registration in a country or cannot receive money directly for work in that country. And we cannot make a contract with an organization that is sort of an intermediary. So if you're an INGO and can directly receive money and go into a contract about work in the country you want to work on, you are very much invited to apply. If you would have to work through your head office to receive the money, it cannot be done. And then finally, I think there was a question on whether a regional program can be supported. That is something I want to again stress. Naushin has already mentioned this, but the focus should be on one country or a region within the country. Cross-border international collaboration will not be part of this applications. We do intend to ensure that people from different countries that receive grants can communicate with each other, that there will be an exchange, that there will be learning exchange, but the project should focus purely on supporting test and treat and testing uptake in the countries according to the RFP. And then I think there was there is a, so the question came from a French speaker, so I hope the interpretation works well with my speed of speaking, but a regional proposal, which means multiple country, cannot be submitted for a region in a country, especially with larger countries. We would expect that to be possible. I think with this, I've put a lot. I'll look at the Q&A. Maybe I'll let either Naushin or others see if there's specific questions they want to raise now, and I'll have a quick look at what other questions are open.
Thanks very much, Willow. And I just want to step in here to reiterate that if you do have a question, please feel free to write that in the Q&A box as opposed to the chat box, so we can ensure that we're tracking everything appropriately and that the responses can be recorded and shared later on.
So we have a question from Matthews F. Teresa, which says, which is regarding the time frame. So the guidelines suggest that the advocacy strategy needs to be developed outside of the implementation period of 6 to 18 months. So your question is whether the salaries are eligible during the strategy development, and yes, the answer is yes. So once you sign the contract for us, you can decide the amount of time to be spent in the actual development, for which we do have timelines. And following that, you can decide whether you want to spend 6 months on implementation or 12 months on implementation. That's really up to you. So you can cost for the time spent to create the strategy as well.
To Christophe from RDC, there are no specific provinces targeted in RDC. The whole country and all the provinces are eligible.
There's another question from an anonymous attendee asking, since our country has limitation on testing capacity, advocating for one test per 1,000 people might be impossible. Is it all right for our proposals to focus on linkage to treatment? So Willow, you might want to add to it, but I think we can't only focus on treatment. We will have to advocate for both diagnosis as well as the linkage to treatment.
Yes, linkages to treatment would be viable. I think what we don't expect is all countries to be able to get there. We really need the support of all of your advocacy power combined on this call to help us get closer to that. So any proposal that helps us increase testing capacity in a country, increase ability of linking patients to treatment would be eligible. So I think the way I interpret your question is it should be within scope, as long as you have a good way of indicating in how you would do the sort of screening and ensuring the linkages to health. So I think that's fine. I do see a question from somebody about Turkmenistan. I do appreciate the complexity that you're indicating. The problem with Turkmenistan is different. Turkmenistan is an upper middle income country, so it is actually not an LMIC, and therefore work in Turkmenistan sadly would be excluded from eligibility under this call. We will post a link to the countries. In Central Asia, Tajikistan, Kyrgyzstan, and Uzbekistan are eligible. Kazakhstan and Turkmenistan are upper middle. I also see a question, can an organization be a sub on multiple consortia? Basically, yes, but as in my prior answer, you can submit one as the lead for a country. So in one country, one organization can provide one proposal as a lead. If it works with others that include work by them as part of their proposal, it's possible. Again, we are not expecting anyone to submit a proposal per se as a consortium. You can link in your proposal and mention how you intend to collaborate with others, whether you've made those agreements formal or not, but we expect individual organizations to submit and be responsible for the whole project.
We have another question from Sharonan asking, to be clear on advocacy, this includes towards government to reflect WHO guidelines, as it will hopefully evolve to include self-testing and outpatient or oral antivirals and for speedy scale up. Is that correct? And yes, Sharonan, that's correct. So the advocacy includes to government, to healthcare workers, to regional stakeholders, and Willow is going to add to that.
Yes, and I think it's a clear point, Sharon, about the rapidly evolving self-testing as well as linkages to treatments that are really only starting now. So we're taking a fairly liberal approach to that. We want to ensure that as much as possible we almost stay ahead of the WHO guidance to sort of improve guidance in a similar way as that is being used in higher income countries. It's really about equity and helping to drive up testing and treatment approaches. I think I've seen a few questions, both in French and in English, Nosheen, about a template for the proposal. Do we have one? Could you answer that, please?
Yes, I've been noting this in my written responses, but there is no template for the narrative section of the proposal. However, we do have requirements for this section noted in section 7 of the RFP under application guidelines, and this lays out the outline of information that's expected in the narrative section of the proposal. So along with that, we do require that you fill out 2 accompanying templates that are found in the appendix to the RFP. Appendix A, which is the financial proposal, aka the budget proposed for your activities, and section B is the self-check form that I discussed earlier in the overview of the RFP section. And I believe we note that their applications should be a maximum of 9 pages and submitted in PDF form. However, the appendix templates that are required, the budget and the self-check form, do not count towards the 9-page maximum.
Thanks. And then there's a few practical questions I see here in Andrew Samuel. Could a proposal be aimed at specific audiences like migrants and migrant workers? And in principle, yes. However, I think the point you're making about the government being responsible for testing and treatment, that is true. Really, the focus here is on helping those governments to be more inclusive and expanding their services. So whether that is through direct services to migrants or migrant workers, in this case, that will be feasible, but also to push the government to do more for migrants or migrant workers. That latter one would be possibly stronger. Karishma, there's a question I see again from Sharon in about what will happen afterwards in terms of technical webinar to increase knowledge of evolving landscape. We are planning a number of activities that should support all the selected partners, all the winners from this RFP. Maybe you can add a few ideas that we have, and we will be inviting winners to also submit questions to us so we can focus our support to them. But this is definitely, I think, a yes. But can you answer that, please, Karishma?
Yes, sure. So just to add to what Willow said, once all the organizations are selected, we will be planning to organize. We still have to fix the cadence, but we're looking at having maybe meetings once a month or once every 2 months of all the selected parties. So it'll also be an opportunity for the organizations to sort of share their learnings and exchange ideas. And in the process, we're hoping to build an advocacy network on test and treat and a community of practice out of the selected organizations. And in addition to that, Sharon and we have also launched technical RFPs, both FIND and United have. So we will also keep you posted on the outcomes of those other RFPs, which are more technical in nature, through our website and our social media channels.
Thank you. One more about regional networks. Can we submit as a regional network with focus on just one country? Yes, you can, as long as you have a legal entity that is available that works in that country, and then focus on indeed the country. So that's similar to the ones before. There's a question, is an organization developing own advocacy materials? That is certainly possible. In line with what Karishma just mentioned, there is also going to be materials and information available to use as a basis for this. So we certainly would promote people and organizations to think about the advocacy materials required, and creating your own where needed for the local context is certainly squarely within the context of this answer, of this RFP, sorry.
We have another question from Anonymous asking, what are the exact items eligible for the coverage by this project? Are ventilators and related machines, devices, and medicines available? So the answer is no, because this RFP is focused on advocacy strategies, awareness raising. So for example, if you need to work with a media agency or a digital agency to get paid social media done, or to get an article placed in a newspaper, for example, those sort of things can be funded. But it depends on how you plan to link the device to the advocacy strategy, and Willow would like to add to that.
Yeah. So so that's right. So this project will not accept any proposals that are aimed at service delivery, on testing, on creating a testing strategy or a treatment strategy or oxygen. However, if you would need as part of this proposal to have a few tests available to do some demonstrations, or some devise one just to do, if you feel that that's an approach to advocacy that's worthwhile, you may do it. However, we don't expect any major procurement to happen, but smaller numbers as exhibition in the context of advocacy, communication, and awareness raising is possible. So smaller amounts, yes, as long as they clearly work towards advocacy and awareness raising, and not for, per se, treatment and care directly. There have been a few questions on the target that has been set of 1 per 1,000 people. I think I've seen 2 or 3 questions there. The way the world has looked at the need for testing is that on average, based on benchmarks that in a variety of ways have been set, that if a country, for instance, has 1 million inhabitants, we would expect in the pandemic, on average, during the lifetime, that for every 1,000 patients in a country, you would need to do 1 test of one of the 1,000 persons per day to have enough testing done to be able to control the pandemic. So if you have a country with 1 million people, you would expect 1,000 tests a day to be done. Of which the general tendency is that the expectation is that there would be something like a 5% of those people tested would turn out to be positive. This is an average number, but this is the way to go. And there are a few places on both our website as well as in the ACT strategy that I would promote everyone to read. On our website, there is a ACT strategy for 22-23, and that includes the information on how the targets were set and what they mean. For Koba, Charles Koba, who asked the question, answer: the criteria for applications are on our website, and they're also available in French. So maybe Noshin or Kirshma, you can put another link into the French RFP language so that it's clear.
We have another question from Ornel Latier. So the different advocacy strategies should be submitted at the time of the proposal submission within the activities we want to submit. Is that right? I'm not sure if I fully understand your question, but at the time you need to develop your plans for your strategies once you have been selected.
And for me to add maybe to that, I think we do expect over the period of time to see things progress. As was one of the previous questions, we see an ongoing evolution of testing guidelines from WHO. We see strong evidence of new treatments that will become available that will lead to new guidance on testing and treating. So what we would expect you to describe is an experience with advocacy and communication awareness raising around the activities, but we certainly also understand there will be an evolution of those strategies and activities during the project. So as much as it is important to describe briefly your strategy, and activities. It's also important for us to understand your track record and experience, because we're investing as much in a partner we feel confident in that can deliver in a rapidly evolving environment, and not just based on a technical experience. And maybe one thing that I would want to add, and Karishma, you can add, first of all, we don't expect very long proposals. I would like to ask Nosheen or Karishma for you to add something on so that expectation. What is important to us is understanding how you can make a difference. We want to make it simple for you. We don't expect any detailed budgets. We don't expect a massive amount of accountability afterwards in terms of usual track records and record keeping. The grants are relatively small, but they need to be focused as much as possible on getting work done, on drumming the beat, on ensuring people understand the essential role that testing and treatment will play in the control of the pandemic moving forward. So we want you to focus on those aspects and not on the administrative aspects. So the question on what you want to use the money for, as long as you can convince us that the activities, the outputs are viable and that they will make an impact. In principle, you can use that money and split it, whether it's between staff salaries, whether it's procurement, whether it's logistics, whether it's travel within the country, whether it's media, whether it's paid media. All of those are eligible as long as they stay within the size of the budget. We are not wanting to prescribe how you do your work, whether you use a consultant or a partner or your own staff. We don't want to say what is the best strategy in your country. We want to hear that from you. And we hope to hear from you that within that budget, you can achieve a certain amount of activities that will lead to raising awareness. That's what we want to hear.
Nosheen, do you want to add to what needs to be submitted in the proposal?
And the size of the proposals as an indication. Again, we don't have a fixed criteria, but I don't expect very long proposals.
De la proposition, nous n'avons pas de critères très précis.
Karishma or Nosheen, are you on mute? I can't hear anything.
Sorry, I was on mute. I just reiterating that the maximum length of the proposal, the narrative proposal in PDF would be 9 pages. But that's, don't feel encouraged that you have to hit the 9-page limit. Certainly, as long as you cover the sections of the proposal requirements in section 7 of the RFP under application guidelines, we'll consider any applications that meet these minimum requirements as long as you submit the required information and meet the exclusion criteria. So just echoing Willow's statement, we want to make this a simple process for application and ensure that, the requirements we're asking for aren't unnecessarily burdensome to the organizations that are applying.
Samuel is asking a question which is very dear to my heart.
Yes.
Thank you, Samuel, for asking the question. So what we basically want to, this nasty English construct of a message basically says, how do we know that the money you have received as part of this, if you win a proposal, is used and has an impact? So how do we know that it has made a difference? What will you measure? What will you see in the country? Are you pushing for a discussion on the price of testing? Are you engaging many people from the government that need to take decisions? Are you pushing parliamentarians to speak out to do more? Are you creating information campaigns on social media? How many people will you then reach? How many will read it? In what language? None of this is prescribed, but we want to know from you, if I ask you the question after you submit the proposal on how will I know that you have been successful? what basically will you show me that make it? So none of that would be anything to do with the number of hours spent, the amount of money spent. All of that is irrelevant. It's about reaching many people and creating change, as all of you do on a day-to-day basis.
We have a question from Alberto on asking if we need to directly advocate among people, or can we also propose ideas capacitating providers in improving access to appropriate information through diagnostics and treatment? I think the latter group certainly counts as like a well-articulated target audience. So you can submit an application proposing that this be the target audience, and you aim them through your advocacy activities in better arming them with this appropriate information on diagnostics and treatment.
Absolutely. To add, Nosheen, basically, yes, both can be done. Although, of course, if capacity providers significantly scale up, there may be a bigger impact of your work. So both are definitely possible. The question is, how many people can you reach directly? But we certainly think that these indirect but focused initiatives that you hint at here could be really powerful. So basically, both options you mentioned here are potentially eligible.
We have two hands raised. The first one is from Koba Charles. Carolina, do you think you could please unmute him or her? Koba, would you like to go ahead and ask your question? Koba, are you there?
Oui, il faut parler.
Yes, I think we can hear you.
Oui, bonjour. Moi, j'ai une
Bonjour.
question.
Oui.
C'est Israël du RAP, Réseau africain des personnes vivant avec le VIH Afrique de l'Ouest. Ma question, c'est, je pense plus aux personnes qui vont examiner les propositions. On me dit qu'il n'y a pas de formulaire, il n'y a pas de canevas. Donc, je me dis, peut-être qu'il y aura 100 propositions, peut-être qu'il y aura 200 propositions, peut-être qu'il y aura 1000 propositions, 1000 projets. Je pense aux personnes qui vont examiner. Voici les personnes qui vont examiner, et les canevas, les propositions sont différents les uns des autres ou des unes des autres parce que les canevas ne sont pas les mêmes. Je pense que ces personnes vont vraiment souffrir. Les personnes qui vont examiner les projets vont vraiment souffrir. Est-ce que ce ne serait pas bien qu'il y ait un canevas unique? Comme ça, c'est facile à examiner. Comme ça, les personnes qui examinent ont devant eux le même document. Sinon, s'il y a 1000 propositions, les personnes qui vont examiner vont faire face à 1000 documents, 1000 projets tout à fait différents. Je pense que ce sera compliqué. Donc, voici, nous proposons de vous partager un formulaire assez simple, présentation de l'organisation, contexte, objectif, voilà, résultats attendus, activités, stratégies, plan d'action, des choses comme ça, assez simple que tout le monde pourra renseigner. On se propose, nous, le RAP, Réseau africain des PVVIH Afrique de l'Ouest, de vous partager un formulaire comme ça, si bien sûr vous adhérez à notre demande. Merci beaucoup.
Thank you. We're very happy to have a quick look at the format and see if it's helpful for others, and certainly whether it would be sufficient to answer all the questions from the RFP. Our main point is that the maximum submitted length of the proposal should be 9 pages. And as Nosheen was indicating, we even think you should try to be more succinct. It's about proving you can do this and about ensuring we understand the capacity to deliver. Larger proposals will be automatically rejected, so that would solve it. And I don't expect there to be 1,000 proposals, but that's for us as a problem to share. But very thankful for the offer. please send us the proposed format. If we feel that that fits everyone, we could at least offer it to people as some structure. But as Anna, for instance, on the chat has indicated, we do want to give people a format to be creative and to submit a good proposal in the way they think is best fit.
And just if I may add to that, Koba, we do have a selection committee which has been formed in all the 4 languages. So we have a number of people on board who will be reviewing the proposals for each language. So yes, I know it might seem overwhelming for them, but I don't think in this case we are going to receive 1,000 applications. It would be wonderful if we did, but we do have a long list of selection committee reviewers, and based on the number of applications received, we will also be adding those reviewers to a short list. In other words, the number of selection committee members also depends on the number of proposals received and in which languages. Like Willow said, we really welcome your suggestion and request you to share the template that you had in mind, and we can definitely keep that in mind for our future RFPs. Thank you.
I would like to use 1 second to have one of the last questions that came up in the Q&A, which said, what is the point if people had more access to testing but can't have access to treatment? I think this is a much longer debate, and I'm not sure whether the question would indicate the idea that you would be willing to promote a larger uptake of testing, but there's obviously very many reasons to do testing. One of them is to keep people safe. By knowing your status, you'll be able to act and protect both your family, your community from not spreading the disease any further, even if yourself are mildly sick and not significantly at risk for severe COVID. At the same time, as we indicated, we do see treatments becoming available. So there's certainly part of this RFP is to ensure uptake of testing for test and treat paradigms, and at the same time, therefore, pushing for treatments to be available. Thirdly, a good testing strategy can help ensure safety in school reopenings, border reopenings, in economic reopenings. It can help create focused vaccination strategies by identifying hotspots of areas that need to be prioritized for vaccinations. So there are many reasons to do access to testing, and we would like you to bring out to us what you would like to do. If you obviously would be, I mean, there's many places where more of this information is available, but of course, if you doubt the use of testing, this is not an RFP for you.
We have one more hand raised. I think that's the last live question that we'll take from Oscar Luku. Carolina, can you please unmute Oscar Luku? Oscar, are you there? I don't think Oscar is there, but if there are any last questions.
Yeah, of course, everyone can still continue to send questions to the email if they come later. There's another session tomorrow. I see one more question coming in. What's the rationale for LIC when most of COVID cases are called MIC? So to be clear, the eligibility is for LMIC countries. The only exception is high and upper middle income countries. So all MIC countries are eligible. And thanks, sorry, Karishma, I think it's time maybe to close. And
yes, just one last question, Willow, in the chat, which I think we didn't manage to answer, is on the consortium. It's from Austin asking, are organizations encouraged to form countrywide or regional consortia? Alternatively, should the organization submit as an individual entity?
I think we've answered that question in a couple of different ways. Yes, an organization should, as an individual entity, apply. If they want to collaborate with others and want to indicate that in their proposal, that's great. They will be fully responsible for execution and coordinating with their partners. But it's certainly possible to to work with multiple agencies together, we obviously would even think that that's a good idea, but we want individual organizations to apply and not as a consortium. It's the organization that leads that will need to apply. And the video will be made available after the call.
Excellent. So I think we have no further questions, but before we wrap up, we would like to launch a poll, which has just 2 questions. So request you to please stay on and answer this very, very quick poll.
So can I end on thanking on behalf of FIND, Unitate, ACTE, and most importantly, people globally with the need to access life-saving testing and treating options for your interest in this RFP, and wish you all good luck with writing the applications if you are planning to do so.
Thanks, Carolina. We can close the poll now. Thanks again, everyone, for joining. Bye-bye.